Yeah, as Dr. Schneekol was mentioning that, I see patients out in the community. I routinely prescribe this alcohol pharmacotherapy. This is a topic that I have learned during a fellowship and learning every single day during my practice. Now, financial disclosure. During this discussion, I will be talking about some of the off-label medications that Okay, so basically what I was saying that we will be discussing some of the off-label medications that I have listed, and you have that in the slide. The goal of this lecture that I'm hoping that in the end of this lecture, attendees will be able to demonstrate knowledge on the practice parameters regarding evidence-based medicine for alcohol use disorder. So we'll start off with the question. Medication is being considered for a patient with alcohol use disorder, moderate, who also struggles from significant anxiety, insomnia, and restless leg syndrome. He scores 12 on pain alcohol craving scale, that's we call as PACS. His liver function test noted to be elevated, both AST, ALT, as well as GGT. Renal function test is, however, unremarkable. Serum ferritin level is 80. Patient has been reducing his use of alcohol over the past few weeks, but still consumes 1 to 2 drinks per day. He is motivated for sobriety and willing to consider psychosocial treatment. Which of the following could be an acceptable pharmacotherapy in combination with the psychosocial treatment? Please go ahead and vote. Question 2. Pharmacotherapy is being considered for a patient with alcohol use disorder, severe. Patient has been sober in the past month. The goal of the treatment is maintenance of abstinence. Which of the following medications has the best evidence for the maintenance of complete abstinence from alcohol? Okay, so we have greater opportunities for learning here. So we'll go ahead and get started. So we know that we have a lot of research going on for a long time regarding alcohol use disorder, but it still remains pretty prevalent worldwide. And heavy drinking, has been cited as the third largest risk factor for the global disease burden. And it's a tremendous economic cost to the disease. In 2010, we have about $249 billion cost associated with alcohol use, and 77% actually attributable to binge drinking. And alcohol misuse leads to about 88,000 deaths in the US, about 10% of overall death, and 2.4 million deaths worldwide, about 6% of all the deaths. And if you have not seen this data, I think we should all see, this is the 2016 data, which shows that deaths from the alcohol, drug use, and the suicide is the highest level ever recorded. It's like 1 in 4 minutes, and that's kind of mind-boggling